My name is Denise A. Yardley. I'm a senior investigator at the Sarah Cannon Research Institute. For the patient that has received a new diagnosis of breast cancer, I think in many ways this can be very overwhelming. I think for these patients, we really try to intersect the many different aspects of managing this disease, and they all require those individuals that are specialists involved in managing breast cancer. And breast cancer, I think, is very unique in that it really requires a approach with multiple physicians with expertise in the disease. So for a patient that's just received that diagnosis, whether it's from their internist or their family physician, their OB/GYN physician, I think the next step for those patients is to really take a moment and kind of see what breast cancer diagnosis means. And so there are many aspects to that disease. The first and foremost will be looking at surgery as an option for these patients, and what surgery is this patient and a good candidate for breast conservation. And we have such great growth in that, where we're doing lesser and lesser surgery, limited lymph node sampling or even no sampling. And then for those patients who it's appropriate, we look at a mastectomy for those patients, but we then quickly pair that with the consideration of reconstruction to really build in the whole focus on managing the breast or the issue in terms of defects from surgery that can then be corrected with a plastic surgery or even minimal use of radiation therapy for these patients. Radiation is another field I think that has really boomed in the management of breast cancer patients, and we're learning to incorporate different techniques of radiation, very minimal, very small portions of radiation to specific areas with the mammocyte technique that's really spared patients from having to endure what's traditionally been a 5 or 6 week course of radiation, now compressing that to 5 days. And for any particular patient, that may be appropriate or may not be an appropriate evaluation. I think also at that same diagnosis, we like to think about whether there might be a genetic component to the patient. And so we really, with our first examination of the patient and her history, incorporate the family history, and then look if it's appropriate for the patient to maybe be counseled on the consideration of genetic testing that may give different surgical approaches for the patient or consideration for management of the patient in the future, as well as other family members. And once I think we've really addressed the issue of the disease and the breast and how that may be best managed by various different options, I think the next portion is then looking at the consideration of now systemic or the potential that the patient might need additional therapy or not. I think the greatest addition in the last couple years has been some of the direct testing on the tumor by the Genomic Health Oncotype DX, and there are many that are also now coming up to play, looking at the tumor-specific genetic profiling and assessing a risk and whether that risk is appropriate for particular patient subgroups to undergo the consideration of chemotherapy, and more importantly, which groups can be spared. I think that really has been a really welcomed addition to the practicing medical oncologist as well as the patient. And we certainly also look at clinical trials, and I definitely would encourage a person that's facing a new diagnosis of breast cancer to really look at the clinical trials. I think the clinical trials today really embrace the latest cutting edge science that we know of ways to improve the outcomes for these patients. And the clinical trials today are so vastly different than trials 20 and 30 years ago. They're trials that are embracing all that we have been able to conquer in terms of our knowledge about tumor cells, and then putting that directly into a therapeutic intervention that hopefully will also translate in a benefit to the patients. And we can certainly look at the last 8 months for breast cancer has welcomed 3 novel new drugs they have all arisen to the FDA approval based on the women who have appropriately consented to the clinical trials that led to the approval of these drugs.